So the difference between community palliative care nursing and the skilled nursing or block nursing is that they're doing more of the hands-on sort of day-to-day nursing. So they're giving the meds, they're changing the G-tubes, they're doing the baths if the parents need them to do the baths, they're doing the respiratory treatments, they're doing the suctioning, whatever may fit the child's profile. And I sort of come in and I do an assessment every time I go, and I usually do a set of vitals just so I can have a baseline of them. So when there is something wrong, I can have something to compare it to. But I'm doing more of an assessment in terms of how are we doing overall. I'm not just looking at one skilled piece. So like, how's that G-tube functioning? Or I'm sort of just looking, how's the child doing overall? And how's mom and dad or the caregiver, whoever it is, grandma and grandpa, doing overall based on how the child's illness is. Are we having a slow decline? Are we having a quick decline? Are we just hanging out at baseline? Are we improving? And so it's more of case management and psychosocial nursing, I guess, is one way that I would describe it too, because we do a lot of emotional care along with the medical care, more than a block nurse would do. And there are some block nurses who are amazing, and I don't have to go there as much because these block nurses, they have it down and they get it. They get the palliative care. They have the same goals of care as the parents, and we're good to go. How I bring the skilled nursing, block nursing crew up to speed is sort of seeing where they're at, because a lot of times, especially if they're newer nurses, they don't understand the significance or the severity of the diagnosis a lot of times. And so it's sort of like talking to a sibling sometimes, asking the parents, is it okay if we say X, Y, and Z? Are you okay with me talking to them? Do you want me to train them? What do you want me to train them in? And sometimes the parents do it and they're like, yeah, I'm all set. We already did it. But I think it's not fair if the skilled nurse who's in the home every single day doesn't understand that the child is at risk for whatever it is, whether it's a sudden respiratory event or a GI problem, or if we think their lifespan is going to be shorter than a couple months or a couple weeks, or if they're coming in, which happens more often than not, they hire a new nurse as we hit a new declined baseline. And the skilled nurse doesn't know that we're at a new baseline, so everybody's in crisis. I'm coming all the time, and they just sort of walk into this fire that they're not sure. They don't know that it's a fire. And so educating them sort of on everything that's happened and who the key players are, I think, is important, and takes that off the parents, which I think can be helpful.